retina specialists warn that nearly 10 million Americans already have diabetic retinopathy, a number expected to double by 2050.
Yeah, so joining us today to talk about new treatments and technologies is Dr. Jeffrey Emerson, president of the American Society of Retina Specialists. Hey, Doc, so let's go ahead and dive right in. What is diabetic retinopathy and why is it such a concern for people with diabetes?
Diabetes damages the retina. The retina is a very important layer at the back of the eye. It's light sensitive, and damage there can cause blurred vision or even blindness. There are 10 million Americans with diabetic retinopathy. Almost half of people with diabetes will get diabetic retinopathy. We want to detect early and prevent diabetic retinopathy before it causes vision loss.
Yeah, certainly. And just to go down that path a little bit further, how can early detection prevent that vision loss?
In the early stages of diabetic retinopathy, there are no symptoms. So you don't even know you have a problem until there's significant damage. That's what makes a dilated eye exam so important. If you have diabetes and you can't remember your last diabetic eye exam, you should go get one. And if you're having any symptoms like blurred vision, difficulty reading, floaters, shadows in the vision, you really should see a retina specialist. Retina specialists have advanced imaging technology in their clinics. They can evaluate diabetic retinopathy, help you with the options, and get you treated.
That's good to know. What new treatments and technologies are helping patients see longer?
Thanks to research, there are a number of great treatments. They fall into three main categories. There are eye injections, where we put medicine into the eye to help diabetic blood vessels work better. There's also laser treatments and surgeries. Most patients get eye injections. It's very effective and it's the least invasive. Those patients need to come back every month or two for a repeat injection. But I have a number of patients who are in clinical trials, and the clinical trials are looking at longer lasting medicines, so they need their injections less frequently. There's also even newer treatments that are implants or gene therapy, and those may last even longer. So in most cases, we can stop the vision loss of diabetic retinopathy, and in some cases, we can actually reverse and bring back some of the vision loss.
Well, that's certainly good news there. Doctor, what is a retina specialist and why should a person with diabetes seek one out?
A retina specialist is more than an eye doctor. We are physicians. We've had almost 10 years of training beyond medical school, and we are really the best suited to managing and treating diabetic retinopathy. Now, diabetic patients also have other specialists too, like an endocrinologist to help with the diabetes control and glucose control. But it's really the retina specialist who is best suited to helping the diabetic retinopathy.
How can patients find a retina specialist in their area?
It's easy on the website. Findyourretinaspecialist.org. You can type in your zip code or a doctor's name and get their information.
Thank you so much
Thanks
for
so
joining
much.
us.
Yeah.
We appreciate it. Absolutely.